think that really shows through to our trainees, that they really feel like they come to work every day with people who enjoy being here and who enjoy teaching them and training them.
UW is the leader in the state for healthcare, especially advanced healthcare. We are a tertiary care referral center that gets referrals from all over the state, as well as northern Illinois and northern Iowa, parts of Minnesota, parts of Michigan. So we see a variety of complex medical conditions and complex surgical conditions. We definitely employ a multidisciplinary approach within the Center for Perinatal Care. There are dedicated diabetes experts who are nurses with extensive experience in treating diabetes in pregnancy. We have a number of advanced practice providers who work in the MFM clinic with, alongside the fellows. They can see patients independently, and they really help to manage the patient burden and keep the flow of the clinic going. And then we bring in, experts from outside our department, nutritionists and OB anesthesiologists and consultants in things like adult congenital heart disease and how that should be managed in pregnancy. So the center really works to act as a hub for those complicated patients.
On the inpatient service, the fellow really is in charge of running the service. They of course have an attending on with them, but they are kind of frontline working with the antepartum resident. We have an inpatient nurse practitioner. Typically, we get sign out, we round on our patients, we do our scheduled procedures, C-sections, cerclages. I think our program produces a really well-rounded MFM, but I think we have strength over many programs in our ultrasound training. When the fellows are on their ultrasound rotation, their first 2 months of ultrasound training, they spend with our dedicated ultrasound sonographer. And so they get 2 months where she is training them one-on-one in actually scanning and obtaining ultrasound images, figuring out how to use the machines, optimize the machines. And so that's a super valuable time period of instruction for them in ultrasound.
We have a lot of ultrasonographers working with us every day, usually about a dozen, many of whom are very dedicated to resident and fellow education and are happy to teach the fellows how to scan. And then we watch all the ultrasounds in real time in our reading room, where we have a desk that's dedicated just for the fellows, where they can watch the scans as they're happening and learn to interpret the findings and learn how to counsel the patients right alongside with us. UW launched the UW Health Center for Fetal Diagnosis and Treatment, and we provide a wide range of both diagnostic and interventional options for patients whose pregnancies are affected by things like twin-to-twin transfusion syndrome, or open neural tube defects, or complex craniofacial anomalies that require exit procedures. And the MFM team and the MFM fellows are intricately involved in all of that diagnosis and all of that care. In addition to the fetal surgery program is our program for placenta accreta spectrum disorders. We have a robust team that diagnoses placenta accreta disorders with ultrasound and MRI, that counsels the patients preoperatively, and then all of the planned cesarean hysterectomies for placenta accreta disorders are done by myself or one of the other MFMs, and then we always have an MFM fellow and a resident. And so it really provides a truly unique opportunity for MFM fellows to operate and to also teach the residents as they gain operative skills in what are probably the most critical OR cases that we staff.
So the research requirements are standardized across MFM fellowship. Here, we follow the ACGME guidelines. So you're required to have a thesis project.
The project can really be whatever the fellow is interested in doing. So most of our fellows recently have focused more on clinical research projects. We've had past fellows who have done basic science work and gone into a basic science lab to do their projects.
There are faculty who do qualitative research. There are faculty who do randomized control trials. There are faculty who do kind of, big epidemiology database research. And so kind of depending on what your interests are, I think the infrastructure is such that you can kind of find the people that you need to be able to do whatever research project you want. I think that there's a really strong dedication to trainee involvement in research here. I think that there is really just a commitment to not only trainees being involved, but also, first authoring papers, having the ability to be able to present at national meetings, and really, putting trainees first.
So as far as the curriculum, there's strong clinical teaching as well as a strong emphasis on research and education. So I think what makes the program unique is how multifaceted it is into building what can be considered a strong foundation for an academic career.
We have a weekly fellowship didactic series. While our MFM faculty gives some of the lectures, we also utilize experts from many specialties throughout the medical school. We have a great simulation lab for the department that's used by our fellows and residents and medical students. So the fellows have a couple of simulations every year, doing things like cesarean hysterectomies, maternal, code or trauma events. And they also are involved in the sim lab as educators teaching residents and medical students in their sim labs as well.
I think simulation is really important in regard to invasive procedures that are unique to maternal-fetal medicine, CBS, amniocentesis, needle-guided procedures, as well as medical complications and surgical complications.
In our department, in our division specifically, there's just a really wonderful sort of camaraderie amongst the group. People really enjoy working with each other. We have social events and spend time with each other outside of work, and it's just a really great group of people who enjoy their work and also enjoy working with each other. Madison's a great place to live. I think there's plentiful opportunities for outdoor activities. Being on the lakes, there's a lot to do really year-round. People don't shy away from getting outside, even in the cold and the snow. And being a big university in the state capital, there's a really young and energetic population in Madison that makes it a really fun place to live.
I think that Dr. Rhodes and the program as a whole have a strong commitment toward really creating an environment where people can tailor their training to their specific interests and to their career goals.
We have such a wide variety of opportunities that we make it such that you can do anything you want when you graduate. You can be a big-time researcher, you can be a big-time surgical expert, you can be a big-time ultrasound expert. Our fellowship sets you up for success in any of those fields.